I have dropped 3 of our 4 in-network dental insurance plans during the pandemic. Did it help my morale and hurt practice profit? Yes and yes. My name is Dr. Nacho Goodman. I want to share with you why I dropped 3 of our 4 in-network plans just down to 1, what I prepared to do it, and why I realize I'm accepting short-term pain for long-term happiness. So I've been a dentist for 19 years and a practice owner for 15 years. When you take advice from anyone, it's important to know where they are in their career. This may not have worked if I was 2 years into being a practice owner. It may not have worked if I was 30 years into being a practice owner. So what I wanted to do was create a system for my own morale long term. We have 2 offices, we have multiple dentists, and the declining insurance reimbursement from plans was driving me nacho nuts. Being paid less for procedures that cost more to do was driving me nacho nuts. So I knew when I dropped these plans, shifted status, I don't say drop to the paces, shifted status, because they could still come and see us with these PPO plans, and some did. I will share in a positive way, during the pandemic, I feel patients are more willing to stay with the dentist even after shifting status. I've done this before and more patients left, but most will leave in my experience if they came because of their insurance. So what did I do to prepare? 1, we ramped up our in-house membership club program. We talked about it more. We got more patients involved in it. We shared why it's awesome to be part of our in-house membership club. We ramped up marketing efforts and we prepared for lower profit. We prepared for lower cash flow. That stinks. It does. But I realized we didn't have the spaces available in our practice due to the pandemic, the temperature check bouncers, the team members that may have left because they had to be home with children. So I realized that this was an opportunity. It's all about timing for me to test this. And I want to share one of my statements: test, don't guess. I'm testing this out. Will this be the most awesome thing to ever happen to us? I don't know. Will this be the most terrible thing that ever happened to us? I also don't know. But what I know as a practice leader, practice owner, I'm ABC. Always be creative. Always be connecting. And that's what I'm doing with our patients and team, explaining the why, sharing with them why we're doing this. We cannot take less for procedures that cost more. I also do in our practice, with the help of amazing dentists, higher level procedures like dental implants, like more complex restorative care. So that's a big help. You will need to replace some of these services with services that are less insurance dependent. So we notified our patients, we shared the why, we notified them through email, we notified them through face-to-face conversations. We shared the why and answered questions authentically. If anyone has any questions about shifting status with insurance plans, I would love to share my strategy with you. But just so you know, my strategy isn't the only strategy. It's not the best strategy. It's just my strategy. But I'd love to share it with you. Just reach out to me. Email shifting status with insurance, the salsa@dentalnachos.com. You can also text me to this phone anytime you want, 215-543-6454. The more we share, the more we care, the better dentisting world we can build together.